النهارده انا طالعه بالجزء المصري في الدبل ايجنت. وبشكركم مره تانية يعني ان انتم محتضنيني في الاكابه، وشكرا جدا دكتوره سعاد لحضراتكم جميعا. انا اميره زكي، هقدم لكم النهارده كده يعني موضوع بسيط على الساليفري كورتيزول as a biological marker في ال disruptive aggressive behavior in adolescent. Adolescent could be defined as a phase of lifetime between childhood and adulthood, between age 10 to 19, and it's a unique stage of a human development, important time to laying the foundation of the good health. Aggression could be defined as the act that intended to cause harm to another person's or the behavior whose primary or sole purpose or function is to injure physically or psychologically. Aggression could be classified as physical or non-physical, hostile, emotional, and instrumental relational aggression. And for most common disruptive aggressive that included in this study was the oppositional defense disorder, which is a pattern of angry, irritable mood, and it lasting at least 6 months and exhibited during the interaction with at least one individual who is not a sibling. Conduct disorder, that's a poorly controlled behavior that violates the right of the others and violates the major social norms as a result of poorly controlled emotions such as anger. As we all know, the cortisol is a steroid hormone and a glucocorticoid class of hormone produced mainly for the zona fasciculata, and adrenal cortex, and adrenal gland. And the hypothalamic pituitary adrenal axis is the main physiological system, mediates the body stress response, and the paraventricular nucleus releases the corticotrophin-releasing hormone in response to threat signal from brain regions such as the amygdala. Numerous studies examined the social psychological experience that been associated with the dysregulated reactive HPA axis. Some of them indicate the history of significant life stressors that is relatively predictor for hyperactive or hyporeactive HPA axis stress response. Regarding the direct relationship between cortisol and aggression, some studies found that low level of cortisol are associated with aggression in adolescent, while others found that victimization was related to higher total cortisol level. Substance used in disorder in adolescent is a challenge due to the early exposure and impulsivities of adolescents to try them and to get risky-taking behavior under the substance influence. Tobacco use was a primary begins in the early adolescent and reports for being in a time before the time of high school graduation. And one of our Egyptian studies revealed that cannabis also was been most commonly used among adolescents in Egypt. The aim of this work was to compare between cortisol level in a disruptive, aggressive adolescent and matching control groups, and to detect the difference between cortisol in conduct and oppositional, to find out the relation between cortisol level and aggression, and to detect the correlation between cortisol and different life stressors, and also the relation between cortisol and the comorbidity of substance abuse. This study was a descriptive comparative research study done at Al Abbasiyya Mental Hospital, and it included 75 total participants into 3 groups. It was 3 groups. Group 1 was 25 conduct, group 2 25 oppositional, and group 3 were the total healthy volunteers, actually from my neighbors and friends' offspring. Inclusion criteria of this study was being in an urban residency, between 12 to 18 years old, and all were from public and experimental governmental schools. And the exclusion, and whether there is a clinical or borderline range of a medical or endocrinological disorder, an anxiety or depression, intellectual disability, developmental disability, and psychotic disorder among childhood and adolescent. Actually, the diagnosed conduct and oppositional were randomly selected through the adolescent clinic in Abbasiyya, while the 25 control groups was my friends and the neighbors' family. Getting the family approval and consent to share in this study, and then we began at early morning as possible to get the salivary cortisol oral sample. Then all the cases were subjected to the actually psychiatric history taking with physical examination, CBCL, دكتورة أمال باظة aggression, behavior and hostility scale, opposition different disorder rating scale, والconduct disorder rating scale. For the results, we can find out in some of the different life stressors affecting conduct, oppositional, and control group. So we can go for the conduct. They have 60%. There was no impact for their life stressors. 16% have an impact of being in a family with a divorced parents. 8% get the stress of getting failure in one previous academic year, and 8% with both divorce of a parents and a failure of academic year. While in the oppositional defiant group, 72% has no stressors, 4% with divorced parents, 8% with a death of one of the parents, and 8% with both divorce of parents and failure in academic year. While in the control group, 72 has no stressors at all, and 16% with divorced parents, 12% with death of one of their parents. Regarding the cortisol, I'm sorry. The cortisol level for total the 100% of the control group show normal range of salivary cortisol, while in the conduct group we show that more than 92% was very high salivary cortisol and 8% getting normal range. And then for the oppositional group, 48% was a normal, while 52% was high level of cortisol. Regarding the aggression measured by aggressive behavior and hostility scale of adolescent and youth, so we can find out that in conduct group, more than 64% show severe aggression and 36% show moderate aggression. And oppositional, 56% show severe aggression, while 44% show moderate aggression. And for all the total 25 control group, they show none to mild aggressive scales. Regarding the substance abuse among the adolescents shared in this study was 24% of the conduct were smoker to tobacco and cannabis, while the remaining 76 actually were non-smoker. While in the oppositional, we have 60% non-smoker, 8% with tobacco, 8% tobacco and tramadol, 24% smokers to tobacco and cannabis. And regarding for the duration of this abuse, for the conduct group, they abuse for 2, 4, and 6 years. And for the ODD, 24% was abused for 4 years, 16% abused for 5 years, and actually 8% of the abuse was more than 6 years. Going for the relations of cortisol and some different parameters, we can find out that there is a statistically significant difference between the cortisol and the comorbidity of substance and the duration of abuse of different substances in the conduct group, while in the oppositional defiant group, there was a statistically significant difference between cortisol and the gender and age of the adolescent. And for the relation between cortisol and the measurement of the aggression by aggressive behavior hostility scales, we can find out in the conduct group there was a statistically significant relationship observed between the cortisol and the aggression and hostility regarding the total score itself and the physical aggression, while there were no relations found out in the ODD. Then for the cortisol level and in relation to the CBCL, In the conduct group, no significance find out in a relation between the cortisone and the level of the CBCL, while in the ODD, there were statistically significant relationship observed between the cortisol and the both scores of the total score and the externalizing behavior score. To conclude, it was deducted that cortisol is higher in the disruptive aggressive behavior than in the control normal. And then, moreover, it can be found out that it is higher in the conduct more than the oppositional. It was clarified that significant correlation with high cortisol level and physical aggression, verbal aggression, and anger skills detecting the aggression among conduct and oppositional. It also demonstrated higher level of cortisol in relation to the comorbidity of substance and the duration of substance in the conduct. It was clarified that there is a significance between the cortisol level and substance abuse duration and the presence of some life stressors. And it could be shown that cortisol is a significant value, but it couldn't be found as a predictor for aggression that could be used independently from other psychometric studies or even the other hormones that can be an impact for the aggression behavior. And we have some of recommendation to our cases in Al-Abbasiyya for number one is to early screen for the aggression to decrease the impact in schools. For the comorbid aggressive behavior with substance abuse, with advice to follow up in the specialized adolescent addiction clinic. And for parents and families going through rough times, to advise to seek psychiatric consultation to minimize and reverse development of psychiatric disorders. And also was recommended for our study sample to attend the parenting programs and the specific behavior programs designed specifically to deal with the aggressive children or adolescents with families that already go through Abbasiyya clinics. And thank you so much.